once you figure out if you are someone who's at risk of kidney disease because you have a family history of kidney disease, because you have different health conditions such as diabetes, hypertension, or other conditions where you're on a lot of medications, you start that discussion with your physician about screening for kidney disease. It usually starts with some simple blood and urine tests, and then based on that, they'll be able to tell whether or not they need to screen you further for some of the associated conditions of chronic kidney disease. Kidney disease, even though it's very silent early on and you don't tend to get symptoms until you lose about 80% of your kidney function, it has a significant impact throughout your body. It has an impact on anemia. Most people will develop some degree of anemia related to their kidney disease and require medications for treatment of that. The anemia will have impact on your sleep. It will have impact on your energy level. Some people even comment that it impacts on their ability to think and concentrate. High blood pressure, even if you never had high blood pressure, as people have worsening kidney disease, 90% of individuals will develop high blood pressure and require medications for blood pressure. The big problem that a lot of people notice is the swelling in the legs or the fluid buildup that happens around their lungs. You'll need a lot of individuals, as their kidney disease worsens, will need more and more medications to try and control that extra amount of fluid. You might have to change your diet at some point. As your kidney disease worsens, or as you lose kidney function, people may need to restrict potassium and phosphorus to try and accommodate what their kidneys are not getting. Luckily, a lot of these changes occur only on late in the game in terms of kidney disease. So the greater impact you're going to have, the greater focus that you're going to have with your physician is controlling your risk factors, getting your blood pressure under control, getting your lipids under control, getting your diabetes under control, your weight under control, and also controlling your urea. There may be special medications that your doctor will place you on to try and control the amount of protein in the urine and try and reduce the workload on the kidney. The two common agents or two common families of medications that a lot of patients will be on will be ACE inhibitors and angiotensin II receptor blockers. They do have side effects of high potassiums and some changes in kidney function, and that's why it will be important when you're started on these medications to be closely followed by your physician. Additionally, patients can have some problems with malnutrition related to their kidney disease. In the later stages, when you're approaching the need for dialysis, individuals may notice that their appetite is decreased. They have a lot of problems with nausea and vomiting. And the difficult thing, I think, for a lot of people with kidney disease is because they have a lot of other conditions, such as diabetes or high blood pressure, they're on very restrictive diets already. And sometimes it can be very confusing trying to pick and choose what you need to, what you're allowed to eat or what you're not allowed to eat. And working with a nutritionist and working with your physician, you should be able to come up with a plan to what you'll be able to eat and be able to follow. If we focus a lot on trying to slow down the progression of kidney disease, as I said, about 20 million individuals have moderate kidney disease. They have stage 2 and stage 3 kidney disease, where they're somewhere between 30% and about 60% kidney function. Those individuals, we try and work as hard as we can to slow down the rate of change in their kidney function. But we really, unfortunately, still don't have anything that will completely stop those changes. So when someone is below 30% kidney function, we start the discussions about dialysis and transplantation. It's a very personal choice because transplantation is not a cure per se, it's more of an alternative treatment to dialysis. And it has its different, for different people, it has its different benefits and different drawbacks. And getting education and learning about the different choices and modalities are your best bet. Often when someone's below a kidney function of about 30%, we we recommend that they go to different classes where they can learn specifically about the different dialysis modalities, such as hemodialysis and peritoneal dialysis, and learn about transplantation, and go through that initial evaluation process. In terms of hemodialysis and peritoneal dialysis, there's really no difference in terms of morbidity and mortality, but it is sort of a lifestyle choice, and different features of each dialysis modality fit people's lifestyles in better ways. And that will have to be a discussion we have with your physician as to what is the best modality. There's sometimes some conditions that people have had, either they've had abdominal surgeries or they've had different problems with their arteries and veins that may prevent them from one dialysis modality versus another.
iCompassion.org, a registered 501c3 nonprofit, is the first free, independent, and trusted online community for people dealing with kidney disease. iCompassion.org allows people to quickly find information regarding kidney disease and treatment options, and to become a part of an online community to get connected, get better, share hope, and give back. Join today and share your story of hope.